Hello everyone, myself Sakshi Chavan and my topic is 5-hydroxy tryptamine. The subtopics we'll further study are 5-hydroxy tryptamine, second is synthesis, storage and destruction of 5-HT, third is pathophysiological roles of 5-HT, fourth is 5-HT antagonist. Now the first topic 5-hydroxy tryptamine. Serotonin was the name given to the vasoconstrictor substance which appeared in the serum when blood clotted. Enteramine was the name given to the smooth muscle contracting substance present in the enterochromaffin cells of gut mucosa. About 90% of body's content of 5-HT is localized in the enterochromaffin cells of stomach and intestine. Most of the rest is in platelets and brain. Now, the synthesis, storage, and destruction of 5-HT. 5-HT is beta-amino ethyl 5-hydroxyindole. It is synthesized from amino acid tryptophan and degraded primarily by MAO. The decarboxylase is non-specific, acts on DOPA as well as 5-hydroxytryptophan to produce DA and 5-HT respectively. Like Na, 5-HT is actively taken up by an amine pump serotonin transporter, that is SERT, a Na-positive dependent carrier which operates at the membrane of platelets. Platelets do not synthesize 5-HT but acquire it by uptake during the passage through intestinal blood vessels. 5-HT is stored within storage vesicles. The isoenzyme MAO preferentially metabolizes 5-HT. Now the serotonergic receptors, that is 5-HT receptors. The first one is 5-HT1 autoreceptors, inhibit serotonergic neural activity in the brain. The 5-HT1A presents in the raphe nuclei and hippocampus. Anti-anxiety may act through these receptors. Second is 5-HT1D/1B constricts cranial blood vessels and inhibits release of inflammatory neuropeptides in them. 5-HT2A, previously D-type receptor, most important post-junctional receptor mediating direct actions of 5-HT like vascular and visceral smooth muscle contraction, platelet aggregation, etc. 5-HT3, previously M-type receptor, depolarizes neurons by getting cation channels, elicits reflex effect of 5-HT. That is gut peristalsis, bradycardia, transient hypotension, pain, itch, acts by blocking these receptors. Then 5-HT4 mediate intestinal secretion, augmentation of peristalsis. Then the actions. 5-HT is a potent depolarizer of nerve endings. It does exert direct as well as reflex and indirect effects. The overall effects therefore are often variable. The first one is severe. Arteries are constricted by direct action on vascular smooth muscle as well as dilated through EDRF release by 5-HT depending on the vascular bed and the basal tone. In addition, 5-HT releases adrenaline from adrenal medulla, affects ganglionic transmission and evokes cardiovascular reflexes. The second one is visceral smooth muscles. 5-HT is a potent stimulator of GIT, both by direct action as well as through enteric plexuses. The third one is glands. 5-HT inhibits gastric secretion but increases mucus production. The fourth one is nerve endings and adrenal medulla. The afferent nerve endings are activated by 5-HT, causing tingling and pricking sensation as well as pain. Fifth is platelets. By acting on 5-HT2A receptors, 5-HT causes changes in the shape of platelets, but it is a weak aggregator. Sixth one is CNS. Injected IV, 5-HT does not produce central effects because of poor entry across blood-brain barrier. Now the pathophysiological roles. The first one is neurotransmitter. 5-HT is an established neurotransmitter in the brain. Cells containing 5-HT are present in the raphe nuclei of brainstem, substantia nigra and few other sites. 5-HT appears to be involved in sleep, temperature regulation, thought, cognitive function, behavior and mood, appetite, vomiting and pain perception. The second is precursor of melatonin. 5-HT is the precursor of melatonin in pineal gland. It is believed to regulate the biological clock and maintain circadian cycle rhythm. The third is neuroendocrine function. The hypothalamic neurons that controls release of anterior pituitary hormones are probably regulated by serotonergic mechanism. Fourth is nausea and vomiting, especially that evoked by cytotoxic drugs or radiotherapy, is mediated by release of 5-HT and its action on 5-HT3 receptors in the gut, area prostrema, and nucleus tractus solitarius. Fifth one is migraine. 5-HT said to initiate the vasoconstrictor phase of migraine and to participate in neurogenic inflammation of the affected blood vessels. Now, the 5-HT antagonist. The ability to antagonize at least some actions of 5-HT is found in many classes of drugs. For example, antihistaminics, cyproheptadine, chlorpromazine, morphine, etc. But these are non-selective and interact with receptors for other signal molecules as well. The silent features of drugs which have been used clinically as 5-HT antagonist and some newer selective antagonists are described below. The first one is cyproheptadine. It primarily blocks 5-HT2A receptors and have additional H1 antihistaminic, anticholinergic and sedative properties. Like other antihistaminics, it has been used in allergies and is a good antipruritic, but the anti-5-HT action has no role in this condition. It increases appetite and has been used in children as well as in poor eaters to promote weight gain. Second is clozapine. In addition to being a weak dopaminergic antagonist, this atypical antipsychotic is a 5-HT2A/2C blocker. Third is risperidone. This atypical antipsychotic is a combined 5-HT2A plus dopamine D2 antagonist similar to clozapine. Like the latter, it especially ameliorates negative symptoms of schizophrenia but produces extrapyramidal side effects. Fourth one is ondansetron. It is a prototypical selective 5-HT3 antagonist that has shown remarkable efficacy in controlling nausea and vomiting following administration of highly emetic anti-cancer drugs and radiotherapy. Now we will see the MCQs. The first one is, what is the primary function of 5-hydroxy tryptamine, that is serotonin, in our body? So that is regulating mood, sleep and appetite. The second one is, which organ primarily produces serotonin in the human body? That is brain. The third one is, which neurotransmitter is closely associated with serotonin in the brain? So that is norepinephrine. The fourth one is, select the correct receptor type for serotonin in the brain. So that is 5-HT receptor. The fifth one is, which of the following condition is not influenced by serotonin levels? So 4 options are given: depression, anxiety, high blood pressure and sleep disorder. So high blood pressure is not influenced by serotonin levels. Thank you.